This is the HCSM. Let me talk a bit on the vision. What is the vision? My vision is that in 50 years, in Egypt and among the people from Malaysia, because they are part of this, it would exist dentists who know how healthcare systems go, who are decision makers in the right way when it comes to this. Decision makers. Decision makers means politics. Yes, means politics. Decision makers means problem solving and dealing with governments. Yes. Decision makers means that they or you try to convince public and private sectors to work together. Yes. This is my vision. Okay? My mission, the mission statement says that after this model, I need to get into the market and into the education system of dentistry, several dentists who are capable of realizing what is healthcare systems and dealing with the education of dentistry in a totally different way. And this is what I'm trying to do. This realization, awareness on healthcare, and the second thing is education, because we have a massive problem in education. And some of you will be staff members. Some other of you will be people who are decision makers when it comes to this. So this is the mission statement. Let me go further. What is the concept? The concept is simulation of healthcare systems in 12 chosen countries. What are these countries? You'll know this in details. They are Egypt, Malaysia, the United States, the UK, Germany. In which way? What will happen? They will learn academic knowledge on how healthcare systems work in these countries. What happens? In Malaysia, is it only private or is it only public? Is it public with private or they are not integrated? In the United States, how does it work? If I want to open a new clinic, how does it work? In which way? In Germany, when dentists graduate, they do internship, right? You all do internship in Egypt. This internship, in which way is this used? In which way is this oriented, this internship? I want everyone to be looking at this picture, at this image, from another perspective, from out there. Not from the similar perspective of being down there looking. Yeah, well, yes, I'm waiting for the system to direct me somewhere. I'm waiting for the system to direct me to work in a hospital or to be at the faculty. You need to take another perspective of this. Okay? So we will learn what happens within represented countries' systems. Second thing, we will discuss international issues. Do you know why we have a defect in international health? Do you know the term international health? What is international health? What could international health mean? Just give me some feedback. What could international health mean? Anyone? Just hands up. Anyone? I don't buy it. Come on. Yes. Wonderful. Said that it could deal with epidemics. Exactly. This is international health. International health includes diseases that spread among countries, diseases that go beyond the systems of each individual country. This is international health. Systems that are applied to a group of countries, systems that are applied to continents because of a specific criteria. Stuff like this. This is international health. We lack this knowledge, and we are dentists. We are part of the healthcare organization, the healthcare organ in Egypt and in the world. So this is the second thing, how to deal with international health issues. The third thing is the diversity in representation and dealing with healthcare. What does this mean? This means exactly what I've been explaining. That in Germany, for you to be a specialized dentist, you need to go through a program, which is a 2-year program, teaching you how to do this specific specialty. Okay? In the UK, you need to be a specialized dentist, you need to go through exams. Okay? In the US, for you to go through a specialized dentistry program, you need to go into specialty exams first, and then you need to go into 2 years or 3 years, depending on the system, of specialty training. So why is it like that? Why is it represented this way? In Egypt, we have a Minister of Health, we have heads or managers of hospitals, right? In Germany, they don't have this. They have another system. They have, instead of this Minister of Health who knows and controls everything, they have something like a board. And this board controls everything instead of one person. Why is that? And why don't we have this? And why do they have in Malaysia this other third system? Why? It's all because of certain things. Those decision makers in the world are people who are related to our work and what we do. And this is what matters. So we will know the three things, those three pieces of information in each healthcare system. How will we know this? Through a series of lectures, a series of sessions on these topics. Okay, this is one side of the game. What is the other side of the game? The other side of the game is the word fun. In which way? In the way that education is going to be different. I don't want someone to go out there and stand in front of you and just go like, okay, in Germany it's 2 dentists or two doctors controlling the hospital, and these 2 doctors are this and that. And in the UK it is, I don't know, a manager and a Minister of Health. I want someone who's vibrant, who's energetic, who invents new ways of educating this piece of information. And this is what the TOT is for. You will hear this word from me. I don't know if everyone is familiar with it. TOT means training of trainers. Training of trainers is intended to train those group of people who are going to be selected through a selection criteria, through a selection phase. This group of people will get a training of trainers to be trainers, to stand out there and give lectures, to do workshops on things, to teach the concept. So it's 2 parts. Academic part goes into the healthcare systems and healthcare issues, and a skills part going into the scope of 1, public speaking and presentation. 2, communication among dentists and with patients. 3, problem solving. 4, decision making related to politics. 5, scientific and professional writing. 6, reporting. These are skills that will be integrated into this education process. To give those trainers and also delegates, I will give you a bit of a glimpse on these phrases, staff and delegates, a glimpse on how we should be different, in which way we should be different, in this way, education methodology. So this is 1. Who, when, and how. Who, 50% will be Egyptians. 50% of the staff and 50% of the delegates. What is delegates? What are delegates? Delegates are the people receiving the information. Now, at this stage, I'm in the stage of recruiting staff. I'm recruiting the people who will be giving the information. Are they only academic staff giving information like this? No. They should be diverse enough to include people who give workshops, to include people who even make fun outings for people in a way or another, who make the learning process different, who design something that's called capacity building. How can we make people work in teams? This is a skill to be learned. Is it learned through a lecture? Do we give lectures in team playing? For God's sake, this is stupid. If you give a lecture in team playing, then you are fooling yourself. There's nothing that's called lecture in team playing. Hi. To be in a team, you need to be nice and participant. You need to like all of the people that you work with. You need to have a sense of initiative. This is stupid. It's not taught this way. Skills are taught differently. And this is what we are trying to introduce. That teaching and education of skills. Public speaking. Am I going to give you a long, boring lecture on how to stand out there and how to talk? No. I will do this. I will model to you how is public speaking done. I teach professional courses in public speaking, okay? How do they go? Half of them is saying some knowledge, like, okay, don't stand in front of your visuals when you are talking about the visuals. Don't use a monotonous voice pitch or voice level, like, don't talk like this. So today we'll be talking about 3 things. The first thing is dentistry, the second thing is endodontics, and the third thing is oral. So I will tell you, don't do this using words. Yes, But the most important is that I will do this. I will act in this way. I will show you how to move your body around stage. I will show you how to change your voice, pitch, volume, tone on the stage. I will show you what mistakes happen. This is called teaching of skills, education of skills. Okay? You want to know research? Well, you're not going to get a nice, cute presentation on how to do research. No. You will do research, and you will come with this research, and I will tell you, well, this is wrong because of this is wrong because of that, and you will discuss it. And this way, you will learn how to do research. This is the value. Education should be different in this aspect. Okay? So, 50% are Egyptians, 50% are Malaysians. Staff and delegates. Staff, how many staff are we going to be? From 20, 30 to 50, according to many factors that are worked upon now. From 20 persons to 50 persons. This specific group will get a TOT, training of trainers. A very condensed training. It will be 1 week training, daily, almost 5 hours after work, after college. So for everyone not to worry, it will be after college, okay? I will be fully free for this week. It will be either the next week or the one after, so you should know, for anyone applying for staff. It will be either the next week or the one after it. A long week of sessions, including everything. These are directed specifically to this group. So this group will work afterwards with the rest of them, which are called delegates. Delegates are the rest of this model. They are the people who will be receiving sessions for 1 month. 1 month and 1 week. Okay, a month and a week. They will be among you, different people, different ages, different academic years, even staff. Like, I am a junior staff at the faculty, at the Department of Endodontics. And I will be part of it. My colleagues will be part of it. So we are all in a different hierarchy, a different system, and this is vital. Because in the model, you are not anymore the professor, and you are not anymore the student. If I have a strong student who can be the head of the staff, head of academic committee members, I don't mind. He's strong enough to do that, then he will be the head of the committee member. He will be giving orders to me or to the personnel of the committee members. Okay? So 50% Egyptians, 50% Malaysians. The call for staff started 6 October. I need 20 to 50. What are the staff? They are academic committee members and the head of them. Academic committee members are the people who teach, okay? Who give workshops, sessions, lectures, yes. The second thing are media team. What is a media team? They are people responsible for the newsletter, people responsible for photography, people responsible for reporting, media team, okay? Why is that? Because there are people who want to take part in this, but at the same time they don't want to be the people giving the lectures or just receiving the lectures, and it's accepted. Because this is different education. This is education of skills. So, media team, people taking photos, people writing reports and newsletters. We will have logistics and organizers team. What is logistics and organizers? They are the people responsible for getting everyone on time, responsible for having sheets of all of the names, profiles of everyone. They're responsible for arranging and organizing everything with me as a general coordinator and with the academic committee members and with the media team. They are responsible for getting us things organized for outings or things organized for events or things organized for workshops. Okay? Logistics and organizers team. They are the ones who hold the watch for you. Okay, you have just 5 minutes.